Hello, welcome to our summer health webinar. I'm Jamie Callie with RWJBarnabas Health Medical Group. Today I'm joined by Dr. Koda and Dr. Malik. We're going to discuss some ways to stay healthy this summer so you can enjoy the most out of these months. If you are on with us live and you have any questions, please feel free to pop them in the chat. We'll get to them at the end of our discussion. Otherwise, if you ladies are ready, I'd love to dive in and get started.
Sure. Yeah.
Excellent. So just to sort of get us talking about like summer health in general, what are some, it's sunny, it's warm, it's been really nice out recently. But what are some health concerns when we talk about, the summer months in terms of like heat, sun, all of that kind of stuff? What are some things we should be keeping in the back of our mind or reminding ourselves to watch out for as we're enjoying all of this weather? Dr. Koda, I'm going to start with you if you want to chat a little bit about pediatrics, and then we'll move on up through the age groups.
All right. Hi, everyone. My name's Dr. Koda. I'm a primary care doctor, and I see kids and adults, and glad to be here today and chatting with you. I think for me, the big things, and that they're the same for kids and adults too, but I guess the specific recommendations look a little bit different. But I guess I would say the big summer things to be thinking about: hydration status, keeping kids and adults hydrated, sort of sun exposure, sun health, and preventing both sunburn, and then how to stay out of too much heat and overheating when related to sports or just too much sun exposure in general. And then safety. Safety, I sort of divide up into the water safety part and then the sort of other aspects of safety. Water safety specifically being pools, oceans, and then other safety is stuff like kids are at home more, they're more active, things like how to stay safe with bicycling, with rollerblading, with trampolines, because a lot more accidents happen in the summer. Kids are outside more, and then they're home more, they're not in school, so accidents more likely to happen. So some safety concerns there.
Excellent. And Dr. Malik, would you like to speak to adults and geriatrics? Same question about summer health concerns.
Sure. Hello, everybody. My name is Dr. Malik. I'm an internist who works in Belleville, New Jersey. And like Dr. Koda mentioned, the general guidelines are the same, be it pediatric or adult population, where we would limit sun exposure when it's usually more hot during the day, like 10 a.m. to 4 p.m. You would limit exposure then. There are chances of dehydration, so you'd want to stay well hydrated, prevent sunburns, people are more out often, so prevent insect bites, they're on hikes, so all those kind of things, prevent eye injuries, so have your glasses on, your hats on, all those kind of things. But generally it would be the same unless we're specifically targeting a specific population.
Excellent. And you both mentioned 2 points that I want to talk about a little bit more closely. The first one I want to talk about is hydration, which is obviously important all year round, but especially like you mentioned in the summer months when it's really hot outside and you're sort of depleting that without necessarily doing much. Dr. Koda, we'll start with you again. What are your recommendations, especially for pediatric patients, for staying hydrated or rehydrating throughout the day during the summer?
Yeah, so exactly like you mentioned, you can lose a lot of water through various things in the summer without really realizing it. So whether or not that's sweating, just because it's hot and you're outside, you're losing hydration that way. And then also kids are breathing more quickly. They're outside, they're running around, and so they're also losing some hydration in that regards. So ways that I typically recommend kind of staying on top of it. A big thing is just more frequent reminders and making it more available. So as a parent or guardian, whether it's sending an alarm on your phone or having something available much more quickly, going outside, grabbing the kid and saying, hey, here, drink this. Kids tend to not pay attention to some of that stuff. They're having such a good time. They're outside with their friends, or they're at the beach or they're at the pool, and they forget to drink. Their level of thirst isn't often as quickly as ours. So really being on top of just frequent reminders for kids. They don't need to stop and chug a whole bottle of water, but whether it's every 20 or 30 minutes saying, here, take a couple sips of water. That's a great way to get it in. Other good ways to get it in, making it fun. Sometimes kids that hate to drink water, I'm not a huge advocate for juice just because of the sugar intake, but they make healthy-ish popsicles. You can make them at home just with a little bit of flavoring and water, or you can buy healthier ones at the store. So popsicles are a fun way to be getting fluid in as well. If kids start to get really dehydrated or you're worried about their hydration status, they're extra thirsty, they've only gone to the bathroom twice a day, their urine's pretty strong looking, that's a good time to say, hey, heads up for next time, be drinking a little bit more, but then really trying to push those fluids, even if it means a little bit more before bed, to kind of help rehydrate them. Oftentimes, if they're really bad, then doing something like Pedialyte or Gatorade can help give them a little bit of that electrolytes back, as well as with the fluid. And then the last thing I'll mention is with sports specifically. Some kids aren't playing as many sports in the summer because they're out of school with those school groups. But if they are doing sports in the summer, they can get dehydrated really fast. Usually teams are pretty good about taking water breaks or having water available for them. But just keep an eye on your kid. If they're looking kind of funny or they feel like they might need some water, feel free to step in and ask the coach to say, hey, make sure they're getting some fluids there.
Excellent. And Dr. Malik, would you like to speak for our adult and geriatric patients? Same question.
Sure. So I guess it generally depends on what environment you're in. So say you're in the office, you're in a cooler environment. I usually recommend my patients carry a water bottle at all times and just sip through the water. But if you're in the out and it's hot, so the general rule that I follow and tell my patients, which is just easier to remember, is have a glass of water every 15 to 20 minutes if you're directly under the sun. And then, yeah, there are water alternatives. I don't recommend caffeine or sugary drinks because they actually pull all the water out of your tissues. So if you really want to spruce up your water, you can use some lemon, some cucumbers, just to add some flavor to the water. Coconut water is a good alternative, just to stay well hydrated if if you don't like the taste of water, if you just can't have it, not have a lot of it. But yeah, it depends on what environment you're in. But if you're out in the sun and you're going to be in the sun, then yeah, every 15 to 20 minutes, you should be having a glass of water to stay well hydrated. And then, of course, you'd look into other things, whether signs of dehydration, if your skin's too dry, or you're feeling like you're having muscle cramps, or your urine, you're not peeing as often, or your urine is of a strong color, or smell, then of course those are signs that you need to hydrate more than you have been, and just follow that.
Excellent. Some really good practical tips. The other thing you both brought up was, sun exposure. I was wondering if you could both speak a little bit about how we can protect ourselves from the sun while not exactly, while still being out in the sun and enjoying some of that. Well, you don't want to hide from it necessarily, but, what would you, we'll start again with you, Dr. Kota. What would you recommend for your pediatric patients to help keep them protected during these sunny days?
So there's lots of things that you can do. Dr. Malik pointed out that the first thing is just avoiding the days. I feel like I'm taking all your talking points, taking all the, staying outside of this, outside of the strongest sun hours. So if you could avoid being outside between technically 10 a.m. and 4 p.m., that's great. That's hard because a lot of activities, are during those hours, but avoiding those hours as much as possible. So that's first thing. And then the other ways are sort of talking about coverage. So there's the sunscreen, which I'll talk about in a second, and then sort of the other protective things. So specifically for really little kids, so kids who are less than 6 months, the FDA, the American Academy of Pediatrics don't recommend using sunscreen products for kids who are less than 6 months. So those kids, it's really going to be the barrier clothing. So that means hat with a brim that goes all the way around, not just a baseball cap that covers the front. Ideally, some sort of rash guard or something that's covering long sleeves, and then ideally potentially something with longer pants just to help protect against sunburn. And then they make a lot of wonderful products now for shade if you're outdoors at the pool or at the ocean. They make those tents that kids can go under, or umbrellas. It doesn't have to be something super fancy. Just a little bit of something to keep them out of the direct sunlight is huge. And then they make some of that stuff for older kids as well. For the really little ones that you can't use sunscreen on, those are great to be using as a barrier. And then if you think about the sunscreen aspect, sunscreen, love it, apply it frequently. It's going to depend on how often that kid is getting in out of the water, how much they're rubbing off. Usually about every 2 hours. Some people recommend even down to every 90 minutes to be reapplying. I'm a huge fan, admittedly, of the stuff that the not the spray, but the actual stuff you're rubbing in. The sprays work and they're easy and they're nice, but the trick with the sprays is they'll often blow away. They're not providing as thick of a layer. So if you're going to use the spray, especially on places like the face, because it's hard to rub in, just really after you spray, still want to sort of be rubbing it into your skin to really be providing coverage. A lot of people have probably experienced this. You use the spray and then you're like, wow, I got burned so much more quickly. It's just because it's not quite as much product. So staying on top of the sunscreen then also can really help protect. If you do get sunburned, if it's a mild sunburn where there's no blistering or anything like that, putting something like aloe vera on can help for symptoms. Tylenol or Motrin can help reduce pain. But then if it's an even more significant sunburn where kids are fussy, they're crying, they're irritable, definitely call your pediatrician to be checking in and see if there's anything more that needs to be done.
Excellent. Dr. Malik, do you have anything I know that sunscreen sort of is all encompassing for a lot of ages.
Dr. Coda, I basically mentioned everything.
Yeah.
Recommend for adults moisturizing sunscreens and also SPF 30 and higher. And you'd want to wear full sleeves but loose clothes, tight clothes, breezy, airy clothes. So you're still protecting your skin from the sunburns, but you're also protecting from insect bites and all those kind of things also. But generally speaking, everything else that Dr. Coda covered also generally applies to adults as well.
Excellent. And I know we've been talking a lot about prevention and things to do to stay healthy. But I also know that things like heat stroke and heat exhaustion are really common in the summer months. I was wondering if you would both maybe speak a little bit about what those two are, what the warning signs might be, what the difference between heat stroke and exhaustion, because I think sometimes those two sort of get used interchangeably, but they're not the same. And the best ways to prevent them. We'll start with Dr. Koda for our pediatric patients, then we'll go on to Dr. Malik for some of our adult and geriatric patients.
Yeah, so I like to think of it as a spectrum of sort of overheat exposure. The very extreme end, they'll use the word heat stroke, and that's actually where your body is. Another way to talk about it is like shock, that the body has been too shocked by the amount of heat that they've had. So that extreme is things, I guess the other extreme is no heat exposure and feeling well. The real heat stroke that people will talk about is where your body just cannot control the amount of heat that it has. Its temperature is going to be really, really high, 105, 106, potentially higher than that. And that's a life-threatening situation. People are going to be altered, confused, dazed, not responsive. That's a call 911 and be getting yourself to the hospital. The sort of warning signs before that are the heat exhaustion. They have a couple different terms that they'll use for that. And that's sort of the ding, 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 wake up and be paying attention to try to be reducing body temperature before you get to the extreme things. So for kids, and I'll let Dr. Malik talk about what it's going to look like in adults, but for kids, oftentimes they're not going to be saying, oh, I'm super hot. I'm close to heat stroke. They're going to say, they're crying, they're fussy, they're irritable, they're not able to drink water even though you're offering them fluids or water. They're grumpy, they're not talking to you very much. Their skin is going to be really flushed. They may be sweating a ton. Some kids, they're not as great as sweaters, and so they're just going to be hot and really warm to touch, but not noticing a lot of sweat. You may notice that they haven't had a wet diaper or gone to the bathroom in many hours. That's a sign of really bad dehydration. And all of those are the warning signs to cool the body down, whether it's with, taking them indoors and out of the sun, and then also cool rags can be helpful. And then to get some hydration into them as well.
Excellent. Dr. Malik, would you like to speak for our adult and geriatric patients, what those might look like for them?
Sure. So how I'd like to put it is heat exhaustion is just basically dehydration becoming more complicated, and that would ultimately lead to heat stroke. Having said that, some patients will not have symptoms of heat exhaustion and will just move on to heat stroke. Basically, what heat exhaustion means in simple terms is that it's your body's losing excessive water, usually through sweating, and you're dehydrated. Some symptoms that a patient could come in with or could experience are muscle cramps. They could feel like the urinary output is a lot lower than usual. They'd have increased basal body temperatures, like Dr. Koda mentioned. They could have a slow heart rate, and that's something that patients might not be able to tell you, but they could feel like their heart's dipping, or they're nauseous. They feel they're having muscle cramps. They don't have enough water. Any signs of dehydration, a dry mouth. they've been excessively sweating, they're dizzy, they're having headaches, and a heat stroke would obviously be a medical emergency where you'd call 911, like Dr. Koda mentioned, and usually you'd see patients with a rapid heartbeat. Their basal body temperatures are 104 to 106 degrees. They're not sweating as often because now your body has come to a point where it is kind of shutting down in the sense that you don't have enough water to lose through sweating as well. And that's your body's just in a state of shock. That's the right way to put it. And that's how Dr. Koda mentioned it as well. Yeah, it's just in a state of shock and they need excessive hydration when they're in the hospital. But that's a medical emergency and they should be in the hospital for that to be addressed.
Excellent. And I think, as you both mentioned, taking some of your earlier tips in mind, staying out of the sun during those peak hours, having those layers of protection, drinking enough water throughout the day. I think that, like you mentioned, like these are really great ways to mitigate that. But I really appreciate you both taking the time to describe it, because I know that is a concern, especially as we head into the warmest part of summer, towards August and then September, because September is a tricky month. It feels like fall with back to school, but it never is. I
Right.
always want to like pull the sweaters out, and then I step outside and I'm like, nope, it's still summer.
Yeah, and I'm sorry, I don't mean to interrupt. I guess I would say, it does
Absolutely.
happen. A lot of people think, that never happens. That's only on
Yes.
TV that you're hearing about it. And I guess just to give, some examples of people that I've seen over the years, where I've had concerns, it's usually the kids who've been playing on a sport or on the sports team, and their game, for whatever reason, was scheduled for 1 p.m. on August 15th, and they're outside and they're overheating and they're in the sport and they're in the game and they can't sort of take a second to disconnect. The parents not with them closely watching. So kids on sports field tend to be one. People who are at big events, so people who are at sports concerts or sports games or concerts, or at outdoor activities, they tend to forget as well. That's people who I've seen heat strokes in before. Marathoners, obviously, people who've been doing huge extreme sports activities. But then it also happens as simply as things like I saw someone once who was mowing the lawn and was outside in those peak hours and had a big lawn, even though they were on a riding mower for most of it. They were doing part of it as a push mower, and because of that and that extreme outdoor time, and it was actually an adult, got pretty severe heat exhaustion that was heading towards sort of heat stroke and those more severe symptoms. So it really does happen. And so I think just knowing what the symptoms can be and the awareness is a really important first step.
That's right. Just because Dr. Koda mentioned that, I did think of so in adults, there are various factors that could, sometimes me just saying that if you're in the sun and you're drinking a glass of water every 15 to 20 minutes, it doesn't necessarily have to mean that that's enough water intake for you, because it's, patient to patient, history to history matters. For instance, patients who are, who have a history of congestive heart failure or who have chronic kidney disease cannot have as much water because they have water restrictions during the day. So having said that, those patients should be actually more careful, or patients in dialysis, they can't have a lot of water. So they have to be more careful because they won't be just able to rehydrate themselves like any other normal adult would be able to. So, those factors come in mind, then those patients specifically should really watch signs of dehydration. And some medicines, for example, like if you're on anti-inflammatories on a daily basis or antidepressants, they tend to retain water. So there are a lot of factors that play a role. These are just general principles, but the best thing would be to speak to your primary care doctor and then find the best way for you. Generally speaking, yes, you should not be in the sun from 10 a.m. to 4 p.m. because that's the hottest day, the hottest time of the day. And then, adjust accordingly based on the factors, based on how long you have to be outside, your medical conditions, the medicines you're on, all those kind of things.
Excellent. And we're sort of coming to the end here, but I was just wondering if you both had any general health tips that you share with your patients just on a regular basis for the summer. I know we already went through a bunch of them, but I always just think it's nice to end on a little bit of a lighter note.
I always tell my patients to add more fruits and vegetables into their diet that have a high water content. So say cucumbers, celery, oranges, all your vitamin C rich fruits, they're good. So, if you can't have a lot of water, then you might want to switch to something that has more water content, spinach, celery, tomatoes, raspberries, oranges, all of them have a high water content, and those
Mhm.
should work just fine as well. So just add those to your diet.
Excellent.
The popsicles that Dr. Coda mentioned, have a lot of those at home.
Yeah. Popsicles never hurt.
Yeah, never hurt. No, the naturally made one, please don't, not the
Yes.
content ones.
Dr. Coda, is there anything that else that you'd like to share that you suggest for patients during the summer?
Yeah, I think there's so many. I guess for kids specifically, I really encourage families to get them outside. We just spent all this time talking about how to keep them healthy outside, but that there's a lot of kids who they'll sadly that their parents may be home or they have a guardian looking after them, and they'll just sit inside for 9 hours watching TV or playing on an iPad. And some of that's okay, an hour or two, if you can. But spending 9 hours a day, that's not a great relaxing summer. It's not getting their activities, it's not getting them outside and getting them fun with friends. So really trying to just plan some things that you can look forward to as a family, whether or not even that's just, once a month we're going to go out for ice cream, or getting to a specific beach, or kind of making a summer bucket list. It doesn't have to be travel the world, but it can be things like cutting up specific types of oranges in fun slices, or just little things like that can really help make the summer fun for kids. And then really getting outside every day. And then I guess the last, probably not so fun thing, but I would be remiss if I just didn't give a good reminder about pool and outdoor safety. I think that's
Yes.
just a huge thing for all kids and adults too. But I think it's one of the leading causes of death in little kids is drowning. And so just making sure that there's always an adult with eyes on a kid. And that adult has no other extra responsibilities. Even if you're at a pool with 5 of your friends and you all have kids in the water, making it one person's job to always have eyes on the pool, because those things happen quickly. And I've had enough sad cases, both personally and professionally, of kids who have not fared so well. So a nice reminder for pool safety and bicycle helmets when you're outside to help protect all things. But otherwise, I think the summer fun bucket list is a good way to help families just make sure you don't end the summer that it's August 20th and you're like, oh shoot, we didn't, there were so many fun things we could have done and we didn't. That involve your kids in that planning, because I think they'll have a good time.
Excellent. Well, thank you both so much for joining me today, and I really appreciate you taking the time to chat a little bit about summer health. I don't think we have any questions in the chat. Nope, we don't. So I'm going to then sign off, and I hope you both have an excellent rest of your week.
Thank you. Pleasure speaking
Thank
with
you.
you. Have a
Take
good
care,
summer.
everyone.
Okay,
Bye-bye.
bye-bye.